Performance of the NHS. Fewer people than ever now answer yes to that question. Just 29% say they're satisfied with the health service in the latest gold standard survey, the British Social Attitude Survey. It is the lowest level since the survey began 4 decades ago. Given the huge backlogs caused by the pandemic, together with strikes by nurses and ambulance workers and now junior doctors, it may not be a huge surprise. But what are those who run the NHS going to do about it? Chris Hopson joins us in the studio. He's the Chief Strategy Officer of NHS England. Morning, welcome to the Today Street. Are you disappointed, or are you saying to yourselves internally, well, no surprise there?
Well, the NHS is under pressure. Just like the German system, the French system, the Canadian system, the American system, we're coping with the consequences of COVID, the largest and most far-reaching pandemic we've had in a century. We've also got the underlying rising demand from an ageing population. But the thing I think is interesting, Nick, is there are some features which are particularly pronounced in our NHS. If you look at the scale of the workforce gaps we need to close, if you look at the persistent fragility of our social care system, if you look at the size of the investment catch-up we need to make in our buildings equipment, these are all problems that have built up over years that we do now need to start tackling, which we are doing. But look, the reality is...
striking that list, though, isn't it? Workforce social care investment, not us, Gov. It's up to the ministers to give us the money we need.
No, what we're basically saying is, look, the vast majority of advanced health systems around the world are facing longer waiting lists as a result of COVID and real pressure on emergency care. But we are now doing things about it. So we're really clear about what our immediate priorities are.
Well, let's split our conversation into what you're doing and then what you hope the ministers might do for you. The Public Accounts Committee, who look at the way in which public money is spent, MPs on that committee said the other day, the NHS is in full-blown crisis. All the metrics are going in the wrong direction. Are they right?
So if you look at what our key priorities are, they're about recovering and stabilising our core services. So look, we set out a really clear plan of how we were going to tackle those waiting lists last February. We hit the first milestone last July. And before we hit the latest round of industrial action, we were absolutely on target to hit the next target, which is to virtually eliminate people who've been waiting longer than 18 months. We were on target to hit that in April.
So without the strikes, you're saying, you would be on course, but with the strikes...
We were on course. So if you look at where we wanted to be in December, we were absolutely on course. But don't forget, Nick, we had to reschedule 175,000 appointments as a result of the latest junior doctor strike. And we're currently heading for a 4-day strike in a fortnight's time.
So that's another thing we've added onto the government's list. Pay as well. Let's do your list first, though. A&E. More than half of patients in the last figures I saw were spending more than 4 hours in A&E waiting, which is over the target list. What can you do about that?
Well, so we set out last month a plan about how we intend to improve both accident and emergency and ambulance performance. And the extra capacity we added over winter as part of our winter plan has worked. We have now stabilised performance.
Now, the other one that infuriates and enrages people and are often told will be sorted out is the 8 a.m. phone queue to get a GP appointment, which often results in no appointment at all. You're just told to phone back.
So next month, we will be setting out very clearly a plan on how we are going to improve access to GP appointments. And yes, Nick, there are some specific proposals to actually deal with the 8 a.m. rush. Just as a real simple example, so one of the problems is if you actually look at GP surgeries across the country, there are still far too many that are on analogue phone systems, which means you can't queue, which means you can't, be able to call back when you need to. So one of the things we will be setting out is how we address those kind of issues.
Improve the tech. Now, that's your list, as it were, but it's quite a long list you've given to the government here. Where is the long-term workforce plan? You've written it, haven't you, the NHS, and we're just waiting for it to come out.
Well, so look, workforce is a very good illustration about how the NHS needs to work as a taxpayer-funded system. If you look at the staff survey that we published earlier on this month, that shows the strain that our staff are under. But you're absolutely right. Government controls training numbers, it controls pay, and we've not been able to develop that long-term workforce plan, which is why we were so pleased that in the autumn statement, the Chancellor set out the fact that he was going to commission a long-term workforce plan.
Where is it? It's being written.
We've done the work. We've basically now set out what numbers we need over the next 15 years to ensure that our currently very pressured frontline staff have a sustainable workload. That is with government. It is for government to announce, and it's for government, obviously, to fund that plan.
And the talk is that you could be 500,000 staff short if you take in doctors, nurses, GPs, dentists. Is that the right ballpark?
Well, if you look at this work that other people have done, the Health Foundation, we're basically in broadly the same ballpark.
About 500,000.
So what we would need to do is identify about how by working more efficiently, by working smarter, we can make significant dents in that without necessarily having to invest in, vast expansion. But we know we absolutely need to have more training places. And that's one of the things that we set out in the plan. And that's something that our Chief Executive has also set out clearly publicly.
More training and more more pay, you seem to be saying. Now, we read in the FT today that the Chancellor's going to give £3 billion to the health service to make sure the money goes direct from the exchequer to people's pay packets and not out of hospital and GP budgets. Have you in the NHS in England seen that money yet?
Well, so the government said very clearly, which is a very important commitment for them to meet, that the funding that they provide will mean that the extra pay that's required will not affect frontline services. I'll tell you what we need to do.
So have you seen the money, though?
Well, we wouldn't have expected to have seen it yet. I'll tell you what we need to do, Nick.
Yeah.
Well, I'll tell you what we need to do, Nick, is we need to be incredibly efficient, which is why we've already got the most efficient NHS health system in the world. We spend 2p on admin in every pound compared to the Germans 4, the French 6 and the Americans 8. But just one more quick thing, we've then committed to realising an extra £12 billion of savings over a 3-year period. So we're doing our bit in terms of making sure that every single taxpayer pound is used incredibly wisely.
Now, you don't need to be a code breaker to work out that you've come into this studio to say, give us some more money, which is what the health managers always do. We want more money for pay, more money for an expanded workforce, more money for social care, more money for investment. What do you say to the MPs listening to this? And you know the sorts of people I'm talking of, who say they're always after all money, more money. It doesn't matter how much money we give the health service, they always demand more.
I absolutely have not come into the studio to say that, Nick. What I've come into the studio to say really clearly is it's the NHS's job to provide the best possible care within the financial envelope that is provided by the government. That's our job. That always will be our job. The amount of funding that is put into the NHS is a political choice.
But without it, for staff in particular, you can't meet the targets that you have set.
What we are saying is the government is increasing funding, which is always very welcome, but we face choices.
There is one other big choice, often discussed in this country and put on hold, which is don't have a system like we do. Adopt a system like they have in lots of other parts of the world in which those who are a bit wealthier spend a little bit more through insurance and other ways.
Well, Nick, the bit you haven't talked about the BSA survey results today is that 80%, between 80 and 90% of people, depending on which particular bit you talk about, want to have the NHS system. It's a core part of our national life. It's the thing that makes us most proud to be British. The British people want to preserve the fundamental principles of the NHS. The model isn't broken. It just needs to work more effectively. That's us doing our job, but it's also the right level of funding.
Chris Hopson, Chief Strategy Officer of NHS England. Thanks for joining us.
Thank you, Nick.